Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome to another episode of Health Life Matters, because every life does matter. And this specifically will deal with the health segments of the show. We're going to speak about common skin conditions in children. We have one of a handful of specialists online with us, and she's literally in the pediatric dermatology industry, a handful in the country. And we can also take her leading advice with regards to specialists in baby and child skincare. So we will welcome her to our airwaves. But before we do that, please do interact with us. Let us know your questions, comments, and queries with regards to childhood skincare. How do you take care of your children's skin? I'd love to know. I know from as little as, the heat rash to, babies, just getting a reaction to your milk or when breastfeeding, or to the change of diet, and then also exposure to different skin products as well as washing powders or detergents. So these all have effects. And then we also have to look at environmental conditions. So we'll be chatting all about the common conditions of children and their skin. Online, we have Professor Carol Tlela, who's a specialist in pediatric dermatology. So let's welcome her to our airwaves. Thank you so much for joining us, Professor Carol. It's an absolute pleasure chatting to you, and we appreciate your time.
My pleasure, and thank you so much for having me.
So because of your extensive CV, I'm not going to get into that, and I must say it's very impressive, and thank you so much for making time for us, because you do have a busy schedule to talk on this topic, and I'd hopefully like to you to schedule us in for another few shows to specifically talk about skin conditions, whether it's eczema, psoriasis, or any, and we must also add that she does do adult skincare as well, dermatology. But Professor, to just kick off quickly, tell us a bit about yourself. What are you currently doing? We know you're based out in the Western Cape at UCT now consulting. And to just tell us a bit about yourself, how you got into it.
Okay. How I got into it is a different question, but I'm currently heading a unit here, Pediatric Dermatology unit, and I'm at Red Cross Children's War Memorial Hospital, and this is in Cape Town, Rondebosch to be exact. I do have a limited private practice, which I do only in the afternoons on certain days of the week, but I'm also seeing adult patients in the adult hospital. But in terms of how I got into it, it was by chance. It was by default. I hadn't ever thought that I would be in pediatric dermatology. But when I finished studies in the UK, my PhD studies in the UK, my then mentor, just encouraged me to take on a post, which was here at Red Cross. And at the time, I wasn't very clear that what it would mean. But he encouraged me that now that I was already studying a topic that was mainly seen in children, why don't I take this post and then build from there? And reluctantly, I listened to him, but I have to say that when I did eventually, set my foot at Red Cross and started within the post, I fell in love with the field. I fell in love with the content, and as I say, the rest has been history.
So take us through an overview of the common childhood skin conditions that is prevalent in South African society.
Well, I have to say, Goa, the operative word there is common skin conditions.
Okay.
Because I run a risk of just giving a textbook answer and telling you about what are skin conditions that can be seen in the pediatric population.
Yes.
But it just so happens that 2 studies were conducted recent, well, not that recent, let's say it's over 10 years now, where one study was conducted at the Tygerberg Hospital and the other Fortescue Hospital, or rather Red Cross Hospital. In other words, a little bit of UCT and a little bit of Tygerberg, but both those studies were looking at what were the top 10 dermatoses that we are seeing in the pediatric population. And it is very relieving and encouraging to know that there was a lot of overlap in terms of the findings of each. But we could deduct from there that the commonest condition in this population is eczemas. It remains eczemas, and eczemas of various forms. And the next common one is psoriasis. And then there's a large chunk of skin conditions that are seen in this pediatric population that can be put under the banner of infection. So various infections, bacteria, viral, fungal, you name it. And then a smaller proportion of patients suffered from birthmarks of various sorts. And one of the examples of the birthmarks that I think a lot of your audience will be familiar with is what we call infantile hemangioma or strawberry nevi. So that was one of the representative birthmark that was seen in a smaller proportion of patients. So in general, it was eczema, psoriasis, infections, and then a variety of birthmarks.
Okay, so I mean, as a pediatric dermatologist, you've also consult with adults as well. So what would you say are the key differences in diagnosing and treating skin conditions when it comes to children compared to adults?
I laugh at that because there are no overarching differences.
Okay.
There's a lot more nuances specific to specific conditions.
Yeah.
I can just give you an example. Earlier on, we talked about what are the common skin conditions. I'll just give you one example of psoriasis. Remember, it's one of those it's in the top 2 common conditions. So we do sometimes miss psoriasis because it just so happens that when it presents in a baby or in a child, it presents differently than it does in an adult. Okay. So your audience will be familiar with psoriasis and they'll be knowing that we call it an extensive disease. In many ways, you'll see it more on the extensive surfaces, meaning behind the elbows, more on the trunk and on the legs in adults. But in children, it tends to take the exact opposite. So you'll find it in what we say warm body areas or flexural areas. So just because it will manifest differently in a child than it does in an adult, then it is easy to be missed because if a doctor doesn't think this could be psoriasis, then they treat it like any other thing and never arrive at a diagnosis of psoriasis. So that's just one example of the small nuances that will represent certain conditions that will present differently between children and adults. But there isn't a lot of those.
What would you say parents can do with regards to differentiating between normal skin condition and an actual condition that requires some medical intervention, whether it be some possible signs and symptoms to watch out for?
Yeah. So, most of these skin conditions that are seen in the pediatric population are mild. I mean, they may very well be alarming, certainly to an untrained eye sometimes. It's a skin condition on the face and the mother is not happy with the look. But really, very often they disappear even without treatment. But if a child presents with a skin condition, however mild looking it is, if that particular skin condition tends to associate with high fever, or by tend, I just mean if in addition to this rash, the child also has a high fever.
Yeah.
If they also have difficulty breathing, if they happen to have vomiting with that, or if the child the behavior is different, if the mother feels or the parent feels that this child is behaving out of their norm or they look sickly, then the mother should just trust their instinct and think this is a condition that needs to be taken to a doctor. Okay. Because very often a normal rash will just disappear or will not really bother the child that much. So it's those pointers that I've alluded to that I'm saying should alert parents to say, okay, this one definitely needs a specialist or needs a doctor in the first place. Maybe that doctor will then refer further to a specialist.
Okay, and what about the impact of the environment when it comes to childhood skincare? Any potential preventative measures that parents can take, especially taking in consideration the different changes of climate, harsh weather, air condition use, etc.
That's a tough one again because there is yet again no overarching preventative measures that one can apply for all skin conditions. Okay. It just makes sense to just focus on at least one example. Let's talk about eczema.
Okay.
Eczema, as we mentioned earlier, one of the top, it's in the top 2. We have found that there is indeed a significant influence by the environment on the development or even on the improvement of eczema. Examples are, I find families who have, let's say a child has got eczema and it's rampant, it's out of control in Cape Town. And the minute that family moves to, let's say, Gauteng, suddenly the child's eczema improves. Okay. And that kind of underlines the fact that there's something in the environment that contributes to to that particular child's skin condition, worsening or improving. So the environment plays a big role in certain conditions, eczema being one. But let's just take a different example, nutritional disorders. So some, in environments where there are nutritional deficiencies, what we know, and I know you will agree with this, that if they happen to have a nutritional deficiency, or there's a shortage of food in the house, even if though adults will survive that, but the bulk of people or bulk of the population that takes the brunt of that is more children.
Okay.
So a child will manifest more severely and even impacting their health much in a more significant way than an adult will. I'm talking an environment where nutrition is a problem. So that, in other words, the environment can impact the child's health to the point where even they can have deleterious effects. I mean, and we have seen patients dying of kwashiorkor in certainly not so much in the recent past than it did in the past. So I'm just saying multiple environmental factors as well as multiple environmental factors do have an impact differently depending on which patient is affected, but depending on the skin condition as well.
Okay.
You talked about the harsh environment. Perhaps I could ask you to relate that. So the climate, as I said, the biggest impact on it is more on eczema. But let's just give another example of harsh, or so-called harsh environment. Let's just talk about soaps.
Okay.
Yeah. So when parents, unfortunately, maybe not so well educated, they just take in a patient with eczema, for example, they just take any soap or any moisturizer and use it in a child who happens to have eczema or wears that sensitive skin. They may damage their skin all the more, worsening that child's eczema, and unfortunately, in opening it up for further infection, which the infection, in addition to eczema, can push the child to the edge. So it's minor things that you find that you just change them, they make a huge difference. But when done, and sometimes done ignorantly, they have a serious impact on the child's health.
I want to look at the role of genetics, some treatments, and we get more into common skin conditions with our specialist online with us, Professor Carol, from the Red Cross War Memorial Hospital, as she chats to us and delves into specifics sometimes and look at, what you can do to help your child and just to prevent some skin conditions as well. More after the short break. Do stay with us. We're chatting to pediatric dermatologist, one of just a handful of pediatric dermatologists in the country specializing in, common skin conditions and looking at the leading specialist in baby and child skincare. So she's based out at the moment, Red Cross War Memorial Hospital, seeing lots and lots of children, one of the top children's hospital in Africa. That is Professor Carol Hilaal. Thank you, Professor, for staying with us. Let's continue this conversation on possible genetics and what that plays a role in how that plays a role in pediatric dermatology, and does it possibly influence certain skin conditions in children?
There's certainly, genetics play a major role in shaping some conditions that this population you're talking about suffer from. But yet again, it's better to just narrow down to examples. Let's talk about eczema.
Yeah.
Very often patients who are suffering from eczema, the likelihood is that there is family members, particularly on the mom and dad side, meaning immediate family members that already have eczema, or even if it's not eczema, it may be some of these conditions, some of the conditions we put under the name atopic. So they may have asthma, sinuses, allergies, and that predisposes that particular child to have eczema. But in a nutshell, I'm saying genetics play a major role in that a child may not have otherwise manifested with the condition, but just because they come from an environment or a background where family members have that condition, then they also manifest with it. That's just one example. But there are other conditions where the other family members do not have to have that condition. I have an example of one we call xeroderma pigmentosum, in short, we call it XP. So that condition is just purely genetic and it's very random. So patients would just, there may not have been other members, but this person may just have this XP condition. And the specifics there is that a patient who suffers from it, okay, maybe I should just take a few steps back and say, ordinarily when we are exposed to the sun, our skin repairs itself. Basically, our body is geared that we repair damage from the sun. But in patients who happen to have a genetic condition leading them to suffer from XP, xeroderma pigmentosum, they do not have that ability for the skin to repair itself. So as a result, even minimal sun exposure damages the skin so much that they may easily develop these skin cancers that we don't expect in children, or we don't even expect, particularly maybe a dark skin patient, we don't expect in dark skin patients, but just because they have a genetic condition, then they have these skin cancers. So this is just extrapolating one or two examples, but yes, I'm just saying, I'm underlining the fact that genetics play a huge role in terms of what a child will eventually manifest with.
You've mentioned skin cancers there. How common are skin cancers in children here in South Africa?
Well, not common, which is very good. So not common, and we like it that way. Perhaps I could just separate and say we would expect skin cancers if they were to happen in light-skinned patients. We're talking about Caucasian skin patients, but even then, they need to have been exposed to the sun excessively, so from very early on. So we're really happy that they don't develop these skin cancers. I'm talking about the skin cancers that, as a result of sun exposure, hardly ever happen. But then the other thing, that one particular condition that may predispose a child from manifesting with the skin cancer, particularly the one we fear the most, called malignant melanoma, is if they happen to have had a particular birthmark. The name of that birthmark is a melanocytic nevi, congenital melanocytic nevi. And if it presents extensively on the body, and then unfortunately the family doesn't know that they need to be quite vigilant in protecting from the sun, that child, even though the risk is small, but that child has a potential of changes in that particular birthmark nevus for those changes to lead into cancer. But ordinarily, it's not a lot of patients, but yes, in the few that where it can happen, you also want to be vigilant and make sure that you prevent it to the best of your ability.
Absolutely. When you talk about preventative, how important, we want to touch on sunblock and the challenges, the South African sun has, and also the change of weather. But let's look at possible effective treatments when it does come to skin conditions like eczema, possible fungal infections, or even acne when dealing with pediatric patients.
Okay, so we'll do one at a time. So let's start with eczema.
Okay.
One of the gospel I spread is patients, or rather parents, should take seriously what washes and moisturizers they choose, in other words, in applying on their child's skin with eczema, and as they do the specific treatments like cortisones or even antihistamines. So washing and moisturizing right is as important as treatment, is as important as addressing the itch in eczema. So that is, those are the measures that I really would love parents to just take home with. But just focusing a little bit on eczema still, I would like parents to know that we do not like having to use cortisones in anyone, adult or child, but certainly more in children. But then when eczema is active and raw and needing treatment, we have no choice but to use a cortisone. So we have to treat with the cortisone, but the proviso there is that you want to minimize that exposure so as to avoid long-term side effects. So they have to wash right, moisturize right, use a cortisone when needed, but as soon as the skin lesions improve, they put the cortisone aside and use a maintaining agent. And usually the maintaining agent, the examples are one we call calcium urine inhibitors. Your audience may be familiar with products such as Elidel or Protopic, and all they are really is their preventative measures, because they are weak on their own. They will not improve the eczema, but what they will do is they will help maintain the skin clear once the cortisone has been used. But we were just focusing on eczema.
Yeah.
And then in terms of acne, it depends on where you catch the acne, because for the population I see, which is young up to teenage years, so we might find that acne is at its mild stage, where a topical anti-acne agent is enough. I will then just use, I don't know if I can continue, giving examples of brands that people can use, but I probably should avoid. But they can use a topical anti-agent when it's mild. But then there comes a time where acne is so severe, but not that severe. It might just not, it will not be enough for them to use a topical agent alone. Then you have to sometimes then throw in an antibiotic. And the combination of an antibiotic together with a topical anti-acne agent is what helps a child better than if you do one or the other. And then there are some patients who are just significantly severe and there's nothing that can be done but for us to use a systemic retinoid. An example of a systemic retinoid, a lot of your audience will be familiar with, is Roaccutane or Oratane or Acnitane. That's a very effective but very strong anti-acne systemic agent, which we reserve for patients with really severe acne. So just to summarize that, it depends on where you catch the child. If they are mild, they don't need Roaccutane, but if they are severe, you're wasting time if you just use a topical agent alone instead of going straight for the jugular. And then we just to finish off with treating fungal infections. So yet again, there it depends. So I always would like mothers to be aware that if a fungal infection is affecting the scalp, which is what a lot more people are familiar with, ringworms on the scalp, the take-home message is: do not waste time by using a topical antifungal on the scalp because it doesn't absorb. So I don't know what examples that people are familiar with, but let's just throw in an antifungal there, like Whitfield ointment. And Whitfield ointment will not help the scalp. Okay. But the better thing is when the fungal infection is affecting the scalp, the parent should just ask the doctor to please use a systemic agent, meaning a systemic antifungal that can be given orally as opposed to topical. But should this ringworm be on the body, and even more so when it's 2 or less, let's say 1 or 2 ringworm lesions on the body, yes, a topical antifungal can be used. But when there's many patches of ringworms on the body, straight for the systemic agent is the best way to go, meaning a systemic antifungal, and there's a lot of examples of those. And I hope I answered your question, Kawa.
Okay, so you've mentioned ringworms, and that's also a tricky conversation when you're having it with other parents, when you say your child has a ringworm, because possibly people think it's infectious. Now we will, I want to look at, specific topics, in the future with you, and I'm looking forward to elaborating, but if we could just quickly look at ringworms. What, if it is, and what other skin conditions are infectious that you can be cautious and you need to be cautious about?
Yeah. One of the commonest one that we see quite often here in Cape Town is scabies. And I know you guys know that. So ringworm is definite. I mean, probably it's not right to use the word definite, but yes, it can be contagious. Okay. That's one. And then another one is, I just mentioned now that scabies. Yeah. So very often it will be either an adult brings it into the house, and then once one person has it, then it spreads within the family, and then the best thing is just to treat the whole family there. But there's another condition that is contagious, but not as strong as the ringworm and scabies. It's warts. Warts can be passed on one to another. And I know that your audience may also be familiar with this one condition, which is not necessarily warts, but I know to them it looks like they're warts. And the word is mollusca. It's hard for me to, clarify it better than just maybe explain it a little bit. So patients will present with these bumps. They are scattered. They can be anywhere, around the eyes, around the body, but they tend to be characterized by what we call a central umbilication. So it's like there's a bump in the middle of there's a dip in the middle of the bump, even though the pimples look like the rest of the skin. That's called mollusca, caused by virus, but it is contagious. So there's a few of them, and so what I've given you so far is 4. We said ringworm is contagious, scabies is contagious, warts can be contagious, and mollusca is contagious, amongst a few.
Okay, great. We need to take a quick break. When we come back, we talk about sun protection for you and your family, some more treatment, some more advice with our specialist online with us from Cape Town. But thank you so much, Professor Carol. Please stay online with us. We'll chat to you just after the short break. Stay with us. Welcome back. Don't forget to interact with us via our social media pages. And remember, we will upload the show the next day on our YouTube channel, Hilaal TV. Life Matters. If you have any questions, comments, and queries, do interact with us. We've got a WhatsApp line as well as an email. We'd love to hear how you're dealing with your skin conditions. And we will be asking a professor, inshallah, to do a series with us specifically on whether it's eczema, psoriasis, fungal infections, contagious skin conditions. And she is one of a handful of pediatric dermatologists here in the country. She's currently based out at Red Cross War Memorial Hospital, and that is Professor Carol Hilaal. Thank you so much for staying with us, Professor. And I know this is a topic that we can have an entire show, and it is sun protection. So talk to us how parents can protect their children from the sun and sort of effectively look at it on a daily basis. Any advice of parents to parents when it comes to sun protection and the exposure of it to young children?
My pleasure, Gawa. So the first thing to mention there is that excessive sun exposure affects children and adults alike. And the aim is always to minimize it from day one. Okay. So there's nothing like just because this child is still young, they should not protect from the sun. So one thing that I just wish parents would take home with is as soon as they can do it, they should do it. I'm talking about protecting the child from the sun. Because when a child is exposed to the sun, especially excessively so, it may not show at the beginning. You might not see any obvious changes, except for the little bit of redness there and there, depending on the skin color. But what we know now, which is backed by literature, is that these skin cancers that I know your audience is familiar with, they are familiar with. We talked about, maybe we didn't. Oh, we touched a little bit of malignant melanoma, but others we didn't really speak on is basal cell carcinoma or even squamous cell carcinomas. So just focusing on the last two, squamous cell carcinoma and basal cell carcinomas. Literature show that when a patient, meaning an adult, manifests with these two cancers later on in life, what you really see is a reflection of what the person did when they were younger. So early exposure to the sun, especially cumulative exposure, is what eventually leads to these skin cancers later on in life. So what parents should do is just try their level best to just minimize it to the T in terms of exposing their children to the sun. Do their best, because we still want them to let the children play in the sun nicely, but we want them to just not allow it to be excessive and protect to the best of their ability. So I gave examples of how cumulative sun exposure leads to eventual, not all patients, but for the majority of patients, leads to these skin cancers. But there's another flip side. Particularly, I'm talking about the cancer that we fear the most, the one that has potential of really, patients maybe, which is fatal, malignant melanoma. So what literature is showing is that it's not necessarily cumulative exposure, but it is when a child or rather a young person would have had an intense sunburn. So it will be excessive sunburn, and the more they are, meaning the frequency of those sunburns increases the risk of them later on developing malignant melanoma. So I hope it is clear for parents that you just want to minimize it, and even more so, you want to make sure that a sunburn doesn't happen even once. But if it does happen, at least make sure it doesn't happen again. I'm talking about a serious sunburn where a child will be sick, maybe even bedridden. I'm talking about too intense sunburn. That has been shown to associate with melanoma. Whereas for the other two cancers, it's more cumulative. It's like a chronic exposure. So to close there on that particular topic, I would love parents to take a multi-pronged approach when they protect from the sun. In other words, not to rely only on the sunscreen, but in addition to utilizing a sunscreen as they protect the child, to also use long sleeve clothing, to also use a sun hat, to also try and avoid the sun, meaning stick to the shade when you're out there, stick to the shade more than the sun, but to rather do all of that together than relying on one method of protection. That has been shown through literature that it's a multi-pronged approach is more protective compared to just relying on the sunscreen alone.
And I think one of the common mistakes people often don't realize is the reapplication of sunscreen. So just some advice on that. Could you explain the actual purpose of sunscreen, the different SPFs? I know this is a topic on its own, but just maybe quickly expound on that and how often sunscreen should be applied.
Okay, I'll start with the latter. So in principle, it is said that ideally, so sunscreen should be applied every 2 hours. Yeah. It gets more when a child has been swimming or they sweat. So then after when coming out from there, you dab the sweat or after they've come out from the swim, you dry them, but the sunscreen should be applied again. I would admit to you, it's not always practical, but that's how it is meant to be done. That is question number one. Earlier on, you were asking about the SPFs. So really, it's not that important for us to work out the exact formula as to how the SPF is arrived at. But the general principle is that the higher the SPF, the better.
Okay.
So I know that right now the most sunscreens will reflect that the SPF is 50 or more. So we hardly have any sunscreen that will show more than a SPF of 50. So parents should just gravitate towards a higher SPF as opposed to a lower SPF. But I must say that it gets more important for Caucasian skin compared to dark-skinned people like myself. So for me, I can get away with an SPF of about 30, but I would always advise parents with light-skinned patients, or rather parents who are light-skinned and their light-skinned kids, to rather just use a higher SPF, 30, 40, even up to 50 if possible.
So my kids argue with me, Mommy, I don't need to put on sunscreen because the sun is not out. It's a cloudy day today. What do you say to that, Prof?
Oh, deception. Because we are, the sun is all around us. And right now I'm sitting in a room where I am exposed to the sun, even though I'm indoors. The sun rays are coming through the window. We are always exposed to the sun. You can't avoid the sun as long as you're in South Africa, whether you like it or not. And it's even worse, by worse I just mean even when you don't see it, when you don't visibly see the sun rays, they are still there.
Yeah.
So, and then of course, when you're driving, or clearly the children will be exposed when they're at school. So I'm just trying to say, I think that the rule of thumb is that you better protect, meaning you better protect than wait until the problem has evolved, or a problem has shown itself before you start protecting. So just assume that there's sun exposure and it's excessive already, even if you don't see yourself, you don't visibly touch, you cannot see it in a tangible manner.
So my explanation to the kids is if it is light outside, the sun is out. Unless it's dark, then you know that the sun is gone. Let's talk about specific complications and challenges when it does come to treating certain skin condition in infants. I know specifically eczema can be one, especially where the child is scratching, they're still small, they don't know how to handle it. So how can parents handle and, apply certain strategies to sort of help with this challenge?
Yeah. So, Gawa, there's yet again another no overarching answer to that, because the skin conditions are different between, there are, as I said earlier, small nuances. But you did say in infants. So perhaps I could give an example that there are certain conditions which are a lot more, they will appear differently in an infant than they will do in a grown-up child. Okay. But perhaps I'll just earlier on use an example of eczema. You actually asked me to speak on eczema. So I did touch on the fact that patients with eczema, when the eczema is active and rampant and it's on your face, you don't have a choice but to use a corticosteroid. Okay. But you do not want to use, to the best of our ability, we wish we didn't have to use topical corticosteroids, only because of, there are side effects that are known the world over. The fact that their long-term use can damage the skin over time. And I mean, you want, especially in an infant, because it's so early, you want to avoid it. But what choice do you have when the skin is active and looking at you, wanting you to do something about it? So as I said earlier, one of the challenges is the fact that we have to use topical corticosteroids even when we don't wish to do. Yeah. But just going back to what I said earlier is that if you have to do it, it has to be minimized. The gospel is within 2 weeks, that topical corticosteroid should make a difference within 2 weeks. If it hasn't done so in 2 weeks, that particular parent should take the child to the doctor, because ordinarily cortisons are so effective, they work that quickly. But they mustn't just use cortisone willy-nilly, long term. So I'm just saying an example of where the challenge is. You don't want to use the topical corticosteroid in an infant, but you cannot leave the disease rampant or riddling the child without you doing anything about it. But as long as we know that these topical corticosteroids can be used, but they should be minimized. Right. That was example one. But there are skin, like other conditions or other treatment options that we want to avoid in an infant, because what I haven't mentioned is that an infant skin is developing. It develops at least up until 2 years of age. Yeah. So before then, that skin is vulnerable and weak, and so you want to do the best to avoid items or agents or therapeutic agents that have the potential of getting absorbed into the skin, through the skin, and getting into the system and causing deleterious side effects. One such example is salicylic acid. A lot of your audience will be familiar with this, especially on the adult side. But if you use salicylic acid in an infant, when the skin is so weak and vulnerable, that particular salicylic acid can get absorbed easily, get into the system, and cause even worse side effects. There's a condition called salicylism, where a child gets really sick because they've absorbed too much of salicylic acid. Sure. So I'm just saying those are the challenges. You know that the child needs salicylic acid, but just because they are so young, their skin is not yet fully developed, you have no choice but to avoid and may not have other options, because this is the best thing that would have helped the child.
Professor Carol Hilaal, championing in child and infant skin care. We will chat to her just after the short break. Stay with us, and we round up the common skin conditions just after this. Don't forget to interact with us. Back in a moment. Welcome back as we wrap up the common skin conditions in young children with leading expert in pediatric dermatology, Professor Carol Hilaal, and she's based out at the Red Cross War Memorial Hospital, one of, if not the most prominent children's hospital in Africa. So we spoke about treatments, we spoke about common skin conditions, we spoke about sun protection, and I want to lead into some of the psychological effects when it does come to skin conditions. So Professor, if you could discuss with us, are there any psychological effects, and how does it affect the well-being of a child? And I know this is, of course, one of the long discussions, and it's probably not a quick answer, but can you just expound on the psychological impacts of skin conditions and how it does affect the well-being of young children?
So, Gawa, I just want to give examples of skin conditions that may be seen more on invisible sides of the body. And very often it's those that are genetically determined, some of the birthmarks. And just because they happen to be on the external aspect of the body, those children tend to have trouble, especially dealing with that condition. I must say that even eczema may start off in the internal areas of the body, let's say in front of the elbows, but then if it's uncontrolled, it can get get spread to the external sides of the body, can be on the face, and that on its own can impact the child's look in terms of the aesthetics. And if they have to take that to school, they become self-conscious. And as a result, they may have a problem. They may not want to go to school. They may not want to interact as a result, because they are worried about how they look. But then there is also just a whole set of skin conditions where, yes, the condition is on the outside. It is not aesthetically, that pleasing in terms of how other people view it, but it doesn't bother the child. But what is actually compounding the problem is ridiculing by fellow peers, by kids at school, or by other people. So I'm just trying to say, whether it's a genetic condition or a normal condition like eczema, very often, just because these skin conditions tend to be visible and be more on the external aspect of the body, most of those children who are affected very self-conscious, impacting their mental health, I would say. And unfortunately, if they don't want to go to school, it means that they are not able to function at school well, they're not able to succeed and pass, and it becomes a vicious cycle. So if there was anything I would say and would like to just caution parents about is, or rather just, my 2 cents worth, is that can we please have parents educating their own children that it's not correct for their children to ridicule or bully a child who looks different to them. Because if that can be done effectively, that doesn't only empower the children who don't have a problem, meaning visible skin condition, but it also helps protect those that are suffering from the condition. So all parties win at the end of the day. But yeah, that is the example I can give in terms of psychological impact on
Absolutely. We need to lead by example as well and inform our children not to ridicule whether it is their skin, whether it's a differently able child, to always be kind and good. So thank you for that advice, Prof. I want to look at possible discussions that you need to have with your doctor, or questions even that you can ask your doctor when you're worried about your child's skin conditions, or if it's not even prevalent, it hasn't been exposed yet, and you have had maybe eczema, psoriasis, or any skin conditions in your family. What sort of questions should you be discussing with your doctor?
So I do know that very often certain conditions, we did talk about that, eczema, psoriasis, run in families.
Yeah.
Perhaps if there's anything I can say to parents in that environment, is that it is true that it can be that when a child is therefore manifesting with a particular rash, it could be one of those conditions that are common in the family, but it may very well not be. So I would like to caution parents not to run themselves into a frenzy, running into a conclusion that just because there's this white patch on the child buttock, for example, it happens to be vitiligo, just because aunt has vitiligo. So what I would love to encourage parents to do is to first get that confirmed by their doctor.
Yeah.
And only then, when it is definite that this which your child is suffering from is one of those conditions that are running in the family, then can they start worrying about it. But in terms of what discussions that they can have, they are so varying, Gawa, because it depends on what condition is manifesting. Vitiligo is a very common example, and I must admit that I find parents who bring their children just because vitiligo runs in the family, they think the child, just any white patch, it must be vitiligo, and then they bring the child to me. But it's good for them to at least bring the child to me to confirm. But if it is vitiligo, then I would know what to say in that moment. Shane, I know we're running out of time.
Yes. Quickly, does diet play a role in childhood skin conditions?
Very often. I mentioned earlier that there are these children who suffer from what we call atopic diseases, inclusive of asthma, sinuses, eczema. So it's that population group that also tend to have a lot more allergies. So diet therefore plays a role, because just because they have asthma, sinuses, then they may also suffer from allergy to peanuts and other forms of allergies. So yes, diet plays a role depending on the condition that they suffer from. But there are other conditions, for example, acne. For a long time we denied, by the way, I just mean dermatologists denied the role played by diet towards development of acne. But there's literature now backing that up, but specifically citing that diets, high glycemic index diets, meaning diets that have got high sugar or even high fats, can induce acne. This is just to name one, but a few of conditions that can be influenced by diet.
And talking about acne, a very common question people often ask: can children outgrow, a skin condition?
A very direct answer is yes or no, because in principle they should, but then the main question is, do they?
Yeah.
Reality is not all of them would outgrow it.
Okay.
Example or case in point is eczema. It is said that 70% of patients who suffer from eczema in childhood should outgrow it, but we have a different experience. There's a lot of patients who do not eventually outgrow it. But yes, in principle they should, but not all the time does it happen.
So, Prof, we have to round up, and I want to look at your final comments and advice to parents who have children who are suffering with skin conditions.
So I mentioned eczema, and I said to them, please ensure you're washing right and moisturizing right. When there is a need of cortisone, use it, but minimally so, and rather introduce a maintainer in the form of a calcium urine inhibitor. But when it comes to sun protection, please, parents should take on a multi-pronged approach and not rely on one element of sun protection, in this case, sunscreen, over the others. And I do want to caution parents to trust their instincts. If a child happens to have a rash, even if it's mild, if it happens to associate with fever, difficulty breathing, vomiting, or if they think the child is just behaving in their normal manner, they should take that child to the doctor, because those may be associated. It may be a serious skin condition. And I think the other things I mentioned earlier was, if the condition runs in the family, parents shouldn't run into assuming that it is whatever they see on the child is indeed the same condition that other members of the family have. They should wait until that's confirmed before they run themselves into overdrive mentally. Those are all the comments I can give at this stage.
Unfortunately, time is up. We will definitely have to have another session with one of the leading pediatric dermatologists in the country, Professor Carol Hilaal, and we thank her once again for her time. So please pencil us in, and I'll be in contact with you, Prof. And eczema is definitely on the top of the list. We speak about one of the common skin conditions. But it was a pleasure chatting to you, Professor Carol. All the best. Do enjoy the rest of your day, and a very good day to you.
Thank you very much again, Carl, for having me.
Only a pleasure, and thank you for affording us your time. We'll chat again and have a part 2 with common skin conditions, and hopefully we can deal in specifically eczema or psoriasis. And remember, you can interact with us, send us your possible questions, comments, and queries on skin conditions, how you're dealing with it, what is happening within your family, and if you have a little one that is troubling you with the skin condition, let us know. Please do interact with us. We love hearing from you. But stay tuned for our next show as we speak on positive parenting, especially with your little ones in a world of conflict, with Fazila Chiwela, early childhood practitioner. I'm very excited to do the show with her because I love chatting to her when she had her recent seminar and discussion. So what's happening around the world, how we can teach our children still about this war-torn conflict, and positively look at it when we are parenting. But for now, from myself, Hawa Solomon, wassalamu alaikum and goodbye.